you'll find these ribs are all from the same cow. They vary in length, they vary in width, and they vary quite a lot in curvature, as we'll talk about. But you'll find, remember, that the neck vertebrae ran along in this line. And you'll find that the first rib is going to be quite short. As we keep coming backwards, as we keep coming backwards, these vertebrae get a bit longer, and then they get a bit longer, and sorry girlie, and then they get possibly start getting a bit shorter. But what you'll notice is that these vertebrae get wider and wider. So in this vertebrae, in this forerib region here, the vertebrae are very wide and there's very little space between them. And that's important because in this area here, we almost have like a wall of bone because that's where the heart and the lungs are. And if there's anything, we don't want that punctured at all. So the more bone there is, the less chance of puncture, the less chance of damage, the less chance of things going wrong with the heart and lungs, which are being housed and protected within this chest cavity. As we come back further, we know the first ribs pass down quite straight, but as we come backwards, the angle tends to increase. And we like to see in a dairy cow a nice angled rib. And the more angled that rib is, the longer that chest cavity is going to be where that heart and lungs is going to be lying. And that's especially important for the lungs because the heart is going to be housed at the front here, but the lungs is going to occupy all the rest of that thoracic or chest area. So more angled gives us more length of chest, more lung space, and that's what we need. So the more angled, the better. The other thing is we've got two sorts of ribs. The first, all ribs, and you can't see this because it rots away, but you can see that surface is very roughened. In every rib, there is always a piece of cartilage at the bottom. And when the carcass decomposes, that rots away. So you're kind of just left with the bone and not that tissue. So I can't show you this, but please believe me. You'll find in this area, running from the brisket to about that area there, we have got a bone which is known as the sternum, or the breastbone. We have that as well. Now if you can feel up here, and if you're as skinny as what I am, you can feel how the individual ribs are going to attach onto that sternum at the front here. So we have got the first vertebrae in such an area, and we're going to have ribs coming down and they attach directly onto the front, onto the sternum. So the first rib is going to be attaching, it's going to be in about that location I said, and it's going to be attaching onto the sternum in about that location. So the first few pairs of ribs are going to have are going to be coming from the vertebrae and attached directly onto the sternum. But when we come to the last few pairs of ribs, if we could just get this cow to just breathe in, you'd see it really easily. But in a cow which is really, really milked down, you know that you can see a line which runs from the bottom of that last rib and it runs down towards the sternum in a curved type shape. Okay, so what we have here is the bone and then the cartilage angles down. So we've got this rib and the cartilage moves. Here's the rib and attaches onto the cartilage, rib, cartilage, and all the cartilage bits from the ribs attach on and come onto the sternum. So because that's all cartilage at the bottom of the ribs, it means that the ribs can expand as she's breathing. If it was all bone and rigid, you couldn't get any movement whatsoever. So you've got to have that cartilage there. Okay, so we want these thoracic vertebrae to be as long as possible to give us length. You can see how the vertebrae are going to sort of run in this line, and the length of the processes is going to change, short, getting longer, and then shorter. Where we have the long processes, it's not surprising because the long processes give us lots of muscle, and all of the muscles in this area have to hold the forelimb in place. So we can't have muscles doing a job unless they've got bones to attach to, and that's why these very long processes on these chest vertebrae in this region are going to be important.